All right, today we're talking about a really crucial upgrade for our healthcare system. It's a whole new way of thinking, one that's actually designed to tackle the real long-term health challenges so many of us face. But before we get into the solution, let's start with a pretty big question. Take a look at our healthcare system. Is it really designed for the challenges we face today? I mean, really think about it. For most people dealing with long-term health issues, the answer, unfortunately, is probably not. And that's exactly what we're going to unpack. So here's our game plan. We'll start with what I'm calling healthcare's chronic mismatch. Then we'll introduce a new model for care, talk about what it takes to actually build a better system, dive into the 6 key elements, and wrap up with the bottom line, what this all means for getting better care. All right, let's jump right into that first point, this big mismatch. Now, don't get me wrong. Our healthcare system is absolutely brilliant at some things. But the problem is, it was built for yesterday's problems, a totally different era of medicine. Okay, here's the easiest way to think about it. Our system is a rock star when it comes to acute care. You break your arm, you get the flu, you go in, they fix it, and you're pretty much done. It's a reactive, fix it when it's broken model. But here's the thing. Our biggest health challenges today aren't like that at all. They're chronic conditions, diabetes, heart disease, asthma. These things need constant, proactive management. It's a marathon, not a sprint, and our system was built for sprints. So, that's the problem. And this is where the system upgrade comes in. To solve this mismatch, experts came up with a new framework, and it's called the Chronic Care Model. So, what is it exactly? Well, at its heart, the Chronic Care Model, or CCM for short, is basically a blueprint. It clearly lays out all the essential parts a healthcare system needs to have in place if it wants to give really excellent, high-quality care for long-term diseases. And the whole philosophy behind this is pretty cool. It's all about creating what they call productive interactions. This isn't the old-school one-way street where the doctor just gives orders. Nope. This is about a real partnership. A partnership between a patient who is informed and actually takes an active part in their own care, and a healthcare team that's ready for them, a team that has the right resources and expertise. Okay, so how do we actually make this happen? Well, the first thing to get is that this is way more than just a minor tweak. We're talking about a fundamental redesign of how we do things. And this is so important. You can't just slap a few band-aids on a system that was built for emergencies and expect it to magically work for long-term conditions. It just doesn't work. The chronic care model is about building a whole new system that works in concert with our acute care system, one that's specifically designed from the ground up to handle the needs of chronic illness. All right, so if we're building a new system, what does it actually look like? What are the parts? Well, it's built on 6 essential elements that all have to work together. Think of them like the key features of this new healthcare operating system. First up, element 1, the health system itself. This whole thing has to start at the very top. You need senior leaders to visibly support and champion these changes. They have to build a culture where quality care is actually incentivized and where mistakes are treated as chances to learn, not something to be swept under the rug. It's really all about setting the tone for the entire organization. Okay, with that leadership in place, the next element takes us outside the hospital or clinic walls. It's the community. This model gets that your health doesn't just happen in a doctor's office. It's shaped by where you live, work, and play. So it's all about forming partnerships with community organizations, encouraging patients to use those resources, and even advocating for policies that just, improve patient care for everyone. Now, this next one, self-management support, is a real game changer. This is what really puts the patient in the driver's seat. The goal here is to empower people, to give them the tools and confidence to manage their own health. We're talking about things like setting goals together, making action plans, and making sure there are resources organized to provide that ongoing support. Of course, if you're going to empower patients, you need a team that's actually ready to support them. And that brings us to the 4th element, delivery system design. This is where you redesign how care is actually delivered. You define who does what on the care team. You shift from reactive to proactive, plan visits, and you make sure there's regular follow-up and case management, especially for patients with really complex needs. So, you've got this proactive team and an empowered patient. What do they both need? Good information. That's where element 5, decision support, comes in. This is all about making sure that the choices being made by both the clinicians and the patient are based on solid evidence-based guidelines. You embed those guidelines right into practice, you share them openly with patients, and you make sure everyone is on the same page working with the best available science. And finally, the sixth element is the engine that really powers this whole thing: clinical information systems. Look, this is about using technology and data in a smart way. It means using things like patient registries to do proactive care, providing timely reminders for providers and patients, sharing information across the team to coordinate care, and constantly monitoring performance to see what's working and what isn't. So there you have it, the 6 essential elements. When you put them all together, they build this whole new system. But what's the bottom line? What's the payoff for doing all this work? Well, the results are pretty incredible. When the chronic care model is put into practice effectively, it's a trifecta. First, you get healthier patients with better outcomes. Second, you get more satisfied providers because they aren't constantly fighting a system that wasn't designed for the work they're trying to do. And third, you actually get cost savings. It is a genuine win-win-win. And look, this isn't just some pie-in-the-sky theory. These are not just ideas on paper. There are actual practical tools out there to help organizations make this change happen. For example, there are specific tools that can help. There's something called the ACIC, which is a survey that helps a clinic assess its current state of chronic care. There's the PACIC, another survey that measures what the patient is actually experiencing. And there are even reports filled with real-world success stories, like Curing the System, so organizations can learn from others who have already done it. So as we wrap this up, it's pretty clear that upgrading our system to really handle chronic care isn't just a nice idea. It's one of the most important challenges we face in healthcare today. The chronic care model gives us the blueprint, which really just leaves us all with one final question to think about. Whether you're a patient, a caregiver, a healthcare provider, or just a citizen, what role can you play in building this new system of care?